In this video, I'm going to be demonstrating the empty can test. The purpose of this test is to test the integrity of the supraspinatus muscle and tendon, where a positive test could indicate a potential diagnosis for Subacromial Impingement Syndrome, or neuropathy of the suprascapular nerve. So for the empty can test, we're going to want our patient either sitting or standing. So first, you're going to want to place their arm into 90 degrees of shoulder flexion in the scapular plane, which is going to be 30 to 45 degrees from the frontal plane. Then you want to make sure that their arm is in neutral rotation, which would mean that their thumb is pointing up. Then, while you're stabilizing at their shoulder, you're going to apply a downward resistance just proximal to their wrist for a longer lever arm, and you want to get them to hold that resistance for several seconds there. Okay, so if there's no pain with this, we're going to go deeper into the test where we're actually going to be testing the empty can. So then we're going to place their arm closer to midline, and now we're going to internally rotate their arm, which is now pouring the empty can. Okay, while stabilizing at their shoulder, you're going to apply a downward resistance again and get them to hold that for several seconds. Okay, so a positive test is going to be pain reproduction when you are testing the empty can, where you're internally rotating the arm and applying that downward pressure there. And weakness is also a positive finding, which both could indicate a potential diagnosis for subacromial impingement syndrome. Okay, so that was the empty can test. If you'd like to see more shoulder assessment technique demonstrations, you can click on either one of these videos. Otherwise, don't forget to hit the like button and subscribe to the channel if you haven't yet, and I will see you in the next video.